Hello guys and welcome to my channel. So today we are starting a new series. It will be focused on the drugs which have been approved recently by FDA, and the drug for today is Omidenepag isopropyl ophthalmic solution. So we will be carrying on our discussion under the following points. So let us take out one point at a time. Let us first have some general information on the drug. So the drug that we are discussing today, as I've already told you, is Omidenepag isopropyl ophthalmic solution. It is sold under the brand name of Omlonti. The strength of this drug is that it is 0.002% or rather 0.02 mg per ml. It is a topical ophthalmic drug. The route of administration is topical. It was approved by FDA in the year 2022. It's a selective prostaglandin receptor agonist and it acts on the EP2 receptor. And this drug, that is Omidenepag isopropyl, it is actually a prodrug of Omidenepag. So now what is the role of EP2 receptor? Now this EP2 receptor, it is actually a prostanoid receptor and it is present in the ciliary membrane as well as on the trabecular meshwork. Now the ciliary membrane, it is actually part of the uveoscleral outflow, and trabecular meshwork, it is a part of the trabecular outflow. Now this EP2 receptor is a G stimulatory kind of a receptor. That is, it comes under the family of GPCR or the G protein coupled receptors. What is the mechanism of action of this drug? As I've already told you, it is an agonist. So it actually stimulates the EP2 receptors. Now since EP2 receptor is a G stimulatory kind of a receptor, so the second messenger system that we get is a cyclic AMP. So this one acts as the second messenger. This increase in the level of the intracellular cyclic AMP ultimately causes relaxation of the smooth muscles and in the tissues and the cells of the ciliary membrane as well as on the trabecular meshwork, right? So we have already told you that this ciliary membrane, it is present in the uveoscleral outflow, and this trabecular meshwork, it is a part of the trabecular outflow. So both the outflows, the relaxation is taking place, and hence there is ultimate improvement in the uveoscleral as well as the trabecular outflow. So there will be increased drainage of the aqueous humor through both the outflows, and since there will be increased aqueous humor drainage, so there will be decrease in the level of the intraocular pressure. So what is the dosage? It is given in the form of one drop, that is given in the affected eye or the eyes once daily in the evening. Now there are certain warnings and precautions for this drug. The most important warning is the development of pigmentation. Now this pigmentation, it basically occurs due to increased melanin content in the melanocytes. Now once Omlonti is discontinued, then the pigmentation around the iris is however likely to be permanent. But the pigmentation of the periorbital tissue and the eyelash changes that are occurring, they are likely to be reversible. This drug can also cause eyelash changes. So what are the changes? This drug can increase the length, the thickness, as well as the number of the lashes or the hairs. And these eyelash changes, they are actually reversible upon the discontinuation of treatment. This drug is also involved in ocular inflammation. Hence, they must be used with caution in patients with active ocular inflammation, such as in patients of iritis and uveitis. It is also involved in the development of macular edema, including cystoid macular edema. Now, this cystoid macular edema has specially been seen in patients who are having pseudophakia and once they receive Omlonti. Now, what are the indication of this drug? We can use this drug primarily in the treatment of primary open angle glaucoma as well as in the treatment of ocular hypertension. The adverse effect. The most common adverse effect associated with this drug is the development of conjunctival hyperemia. Other than that, it can cause photophobia, blurred vision, dry eye, instillation site pain, eye pain as well as ocular hyperemia. What are the administration instructions? So first we must gently shake this bottle prior to its administration. If we are using more than one topical ophthalmic drug, then the drug should be administered at least 5 minutes apart. Now if the patient is also using contact lenses, then these contact lenses must be removed prior to the administration of Omlonti, and they may be reinserted 15 minutes after the administration of the drug. So that's it for today. If you like this video, then please give it a thumbs up, subscribe to my channel and press the bell icon so that you don't miss out on any upcoming videos. And do let me know down in the comments below what are the other topics that you want to discuss with us. So until next time.